Good evening. This is a follow-up to the video I just posted about the use of carotenoids and reduction in hearing loss for children. Another study was talking about the use of antibiotics, multiple use of antibiotics in children from birth until 2 are associated with increased risk of allergies, asthma, which we've known as naturopaths for a long time, but get this, it also listed intellectual disabilities. That gave me a big pause to think about it. Even there are times that I prescribe antibiotics to patients at the clinic, and sometimes it is the right choice. But with things, while there may be benefits, there's always potential for risks, and we need to make sure that we're talking about that. So definitely give rise to think about risk for developing allergies, asthma, but also give pause to think about, do we really need that antibiotic if there is potential risk for some intellectual disability changes? Let's also talk about the function of carotenoids as major antioxidants. What we're suspecting is with the reduction of potential for hearing loss in children is that the carotenoids are actually supporting the cochlear cells that are particularly sensitive to oxidative damage. And so the use of that carotenoid is believed to be really reparative or restorative to the tissues that have oxidative damage. And that could be as a result of an infection in that space, potentially a medication or an exposure, or even loud noises that can trigger damage to those cochlear cells. And so that's what we're thinking the reason for the support with the carotenoids.